three things that need to be addressed with all patients that have plantar fasciitis. The first is what I describe as support. So this comes in the form of a good shoe and potentially considering orthotics as well. So the plantar fascia is the stabilizing ligament on the bottom of the foot. Plantar fasciitis is known to be an overuse injury of the plantar fascia. It gets inflamed, there's micro tears, it develops scar tissue. Eventually, with chronic cases, it doesn't have the best blood flow, so it's hard for the body to heal. So one way to help is by reducing strain through the plantar fascia. And a good way to do this is not by wearing a cast, but having a good supportive shoe and potentially wearing an orthotic as well. The way an orthotic would work would be to offer additional support through the arch, so simply the plantar fascia just doesn't have to work as hard. Okay, number two is what I describe as the rehab principles. So there's very specific stretches that can be employed. You know, if you do a search for plantar fasciitis stretches online or on YouTube, you will find probably 500 different stretches to do, and you know which ones are effective. So I usually nail it down to two specific stretches. So one will be for the calf muscle and the other will be for the plantar fascia itself. For many patients that have been suffering for a long time, I'll normally recommend that they just go off to formal physical therapy or physio to complement their treatment. All right, so number three. So here's the trifecta. How do we actually heal the plantar fascia? There are standard treatments and there are more contemporary treatments that have regenerative capabilities. So a standard option to address plantar fasciitis would be a cortisone injection into the plantar fascia. Cortisone is simply an anti-inflammatory medication that gets injected. I'll tell you, for most chronic cases of plantar fasciitis, it's not even inflamed anymore. So why would you be injecting an anti-inflammatory into something that's not inflamed? So predictably, patients will get on average 2 to 3 months worth of relief with these injections, and then symptoms either come back to the same level or could potentially be worse after the full effects of the injection wear away. I think cortisone injections are best served in patients that have more acute symptoms, and also if they're severely disabled with symptoms, so they're limping into the office, they're having trouble getting back to work, and hence, you know, feeding the mouths at the table. So it's an option to, you know, hopefully get patients back to life sooner than later. And if it's going to work, it usually works pretty quickly. For chronic cases, I don't recommend cortisone injections. Instead, we offer a technique in my clinic called extracorporeal shockwave therapy, or shockwave therapy for short. Shockwave is a regenerative technique delivered through a non-invasive technique. High energy sound waves are delivered into the diseased tissue, and the idea is to cause some excitement, some desirable microtrauma, and with that comes inflammation. And inflammation is desirable because that is the first part of the healing cascade. So for many cases of chronic plantar fasciitis, the body will just simply forget that there's something to heal. So shockwave is almost like the defibrillator for the foot. So it's that reminder to the body that there is something to heal. So cortisone typically would be one injection to see a good response if it works. With shockwave, a minimum of 4 treatments are rendered. For plantar fasciitis, it typically takes about 5 minutes. We do them weekly for 4 weeks, and then basically allow it to marinate over the next 6 to 8 weeks. And generally speaking, patients will start to see effects around that 6-week mark. Overall, patient satisfaction is in the mid 80% range with shockwave therapy. The nice thing with shockwave is that it doesn't pose risk for inadvertent rupture of the plantar fascia, and there's also no risk for atrophy of the fat pad, that cushioning, that desirable normal fat pad on the bottom of the heel, which you would typically see with repeated cortisone injections. The other nice thing is that there's really no modifications required to activities from a recovery standpoint with shockwave. Typically, there will be some recommendations, either modifications or restrictions related to the pathology itself, but not necessarily the treatment. So overall, the personal experience has been addressing chronic plantar fasciitis as a triple-pronged or trifecta approach. So again, this entails a supportive shoe and considering an orthotic as well, the rehab principles, and considering an advanced regenerative approach like with shockwave therapy. And these are the three pillars that we always recommend to all patients at my clinic when patients present with chronic plantar fasciitis. So please let me know if you have any questions in the comment section down below, and I look forward to providing another informative video down the road, so remember to subscribe to the channel. Take care.